Hello, my name is Priyana Reddy, and I will be doing a presentation on global issues of recycling used lead-acid batteries. First, we're going to look at what are lead-acid batteries and what are they used for, along with the risks. Then we're going to be looking at the interview questions asked the professionals. Then you're going to be introduced to the professionals and their approaches. And then based on that, we're going to be looking at the interventions. And then as our conclusion, we're going to look at the lessons learned. So what are lead-acid batteries? Lead-acid batteries are often used in vehicles as backup power supplies, energy storage, for lighting, or power supplies in lower-income countries. Used lead-acid batteries in high-income countries usually have safer recycling practices than in low or middle-income countries. When used lead-acid batteries are improperly recycled to extract lead, harmful lead particles seep into the ground, poisoning individuals who come into contact and contaminate the environment. Soil contaminated with lead can spread throughout the community. Most workers do not have the proper protection when handling lead, and additionally, children often assist with recycling. Due to the toxic effects of lead poisoning in individuals, used lead-acid batteries are classified as hazardous waste. What are the risks associated with lead poisoning? Lead toxicity can affect all parts of the nervous system, causing life-threatening disruption of brain function, especially in young children. Short-term exposure of lead can cause cognitive and behavioral issues in children such as vomiting, loss of appetite, aggression, headaches, and a lack of energy, with high exposure levels leading to seizures, coma, and death. Children can be left with intellectual disabilities, delayed puberty, blindness, and weakness on one side of their body for the rest of their life. Long-term exposure in adults can result in high blood pressure, heart disease, infertility, and preterm birth. These were the interview questions presented to the professionals. 1. Based on the information provided regarding used lead-acid batteries, what are your thoughts on this issue? 2. Did you have any previous knowledge on this issue? 3. What interventions do you propose could help reduce lead poisoning due to the improper recycling of used lead-acid batteries? 4. How would you implement this intervention? Professional number 1 is Vamshi Kalva, a senior engineer at Gore Tech. Vamshi proposed policy, licensing, and funding. For policy, he suggested stronger child labor laws, specifically geared towards children not working or assisting with used lead-acid batteries. For licensing, he suggested a free licensing program in order to recycle used lead-acid batteries. This program will consist of receiving the license in order to get benefits such as higher prices for recycled batteries, free medical checkups, and employment at recycling facilities. And in order to be able to receive this license, the participants would have to go through the safety protocols of how to handle used lead-acid batteries, along with the safety equipment that is needed. He also suggested a government fund specifically for lead poisoning and using it for prevention along with treatment. Professional number 2 is Pavan Krishna, an engineer at Forever Living. Pavan proposed educational lessons geared towards children, such as animated videos and games, in schools that teach children the risks of used lead-acid batteries and the symptoms of lead poisoning. He also suggested multiple community health workers in different communities that worked on testing people and the soil for lead and monitoring safe handling of used lead-acid batteries. He also suggested creating a policy that would only allow selling and buying of used lead-acid batteries from those that follow strict health and safety codes that are set by the government. Those who violate this policy will find it harder to buy or sell used lead-acid batteries. Professional number 3 is Daniela Walter, a teacher at Fort Worth High School. Daniela proposed community education programs that involve educational material on effects of lead poisoning, safety instructions on handling lead-acid batteries, and providing resources for blood lead testing. She also proposed local coalition groups that address issues regarding safe practices and setting goals on improving conditions, along with government involvement through funding for protective safety gear and medical assistance. Based on the responses from the three professionals, the two areas that they seemed to focus on were education and government assistance. So, for the possible interventions, we looked at intervention 1, based on education, focusing on community-tailored education programs that target lead poisoning for both children and adults, helping them understand the effects of lead poisoning and how it can impact their lives. For government funding, this would be used for free medical checkups and blood lead levels, medical fee assistance for those that have been affected by lead poisoning, hiring community health workers to focus on education and resources, and by helping establish safe lead-acid battery recycling environments by creating training classes on safe handling of these batteries. Coming to a conclusion, not much is really known about this issue outside of the environmental field. Only one of the professionals had any idea regarding this issue. More focus should be placed on this issue outside of the low and middle income families. We also believe that governments need to place more policies on the safe handling of used lead-acid batteries in the countries facing higher lead poisoning levels. We also believe that more community education and resources should be available to these communities, and more focus need to be placed on addressing higher lead poisoning levels. And that concludes my presentation. Thank you so much.